if I have chronic allergies or chronic hypersensitivities or my heart rate's out of control, nobody looks at the sleep as an aspect, but it is, and what we're going to talk about today, it's a significant aspect. If you expect performance out of your body during the day or out of your phone during the day, you need to plug it in at night to recharge the batteries. Just because people fall asleep for 8 hours does not mean they're plugging themselves in for 8 hours.
How do I help my patients with this?
So three.
Hi, and welcome to Upgraded Biology. My name is Dr. Tami and I'm your host. Upgraded Biology is the outcome of 20 years of practicing functional medicine and specializing in hormones. This podcast is where we will present all the information and tools I've learned and continue to learn on how to harmonize and optimize all aspects of your health.
Well, welcome to the episode of Upgraded Biology. And today I'm super excited to bring an amazing guest. Sleep Doctor is your nickname, Dr. Peter Motoni. Thank you for being here. Welcome.
Thank you, Dr. Tami. I really appreciate it. We've known each other for a long time, and I really commend what you're doing in the space and how many lives you're transforming. So thank you for having me on the show again.
Our month is focused on cardiovascular health. And I haven't heard a lot of conversation about how sleep can positively or negatively impact our cardiovascular health. But I would have to imagine it's pretty important. Talk to us about cardiovascular risk, but maybe even before that, why do we sleep? Why do we need sleep? I remember you saying quite some time ago, I'd like you to try to go, a week without eating, a week without exercising, but try and go a week without sleeping and see which is the biggest impact. So tell us about why we sleep and how does it affect our heart?
Yeah, no, that's great. So sleep is ultimately and I really like to break sleep down into very digestible chunks for people because the neurology of sleep can get really complicated. Why we sleep can get really complicated, but really in essence, think about your body as a smartphone or a cell phone or an iPhone for that matter. If you expect performance out of your body during the day or out of your phone during the day, you need to plug it in at night to recharge the batteries. So you can't just, expect performance out of your phone all day long in battery life if you're not plugging it in at night. Let's say you're only plugging it in half the time. Well, you're only going to get half the performance during the day. And that's the same thing that happens at night when we sleep. And it's something that we call quantity of sleep versus quality of sleep. Just because people fall asleep for 8 hours does not mean they're plugging themselves in for 8 hours. Because, actually, let's go to another analogy. My ADD brain loves analogies. So think about charging a Tesla on a slow charging station or a supercharging station. It takes half the time on one of those supercharging stations because you're plugging into more energy and you get more repair. So the quality of your sleep is like supercharging your body. So we do not do enough work at night or respect the time we spend in bed as a culture enough to be able to say, listen, if I'm tired during the day or I'm fatigued during the day or if I have chronic allergies or chronic hypersensitivities or my heart rate's out of control, or nobody looks at the sleep as an aspect, but it is, and what we're going to talk about today, it's a significant aspect, and not just a significant impact on cardiovascular health. It's not just how you sleep and the quality of sleep, it's how you're sleeping. So the first 10 minutes when you fall asleep is critical to determine the rest of the night's quality of sleep.
Wow. So those people who are falling asleep to the television or their iPad, they're missing out, I would have to imagine, on those first important minutes of sleep. It's kind of like setting the stage. I used to dance professionally in a ballet company 100 years ago, and what you do to get ready before you're on stage made all the difference to the performance. And I would have to imagine, so we have this rule when I first got married, no TV in the bedroom. And I was like, yay, such a healthy choice. And now these iPads are here And it's like having a TV in your bedroom all over again. So what's happening when we're using devices and televisions to those first few minutes?
And that this is so good that we bring this up. So let's look at the advice that we're talking about right now. The sleep experts are great. They all have great advice, right? Stopping the screen time, cooling your room. These are all pieces of the pie. But the problem is when they missing the crust. The crust that holds everything together is that our sleep or our bodies are regulated by our nervous system. Everything we live our life through our nervous system. You basically how you perceive your environment is not really reality. It's your perception to reality. We sense our environment through our senses, and that's what our perception of what reality is. So it's a distorted connection to the facts. So when you're looking at the nervous system is controlled by our perceptions. So whether we think we're running from a tiger, whether we think we're in danger, your body's physiology is going to change, or we think we're in a loving, nurturing relationship, our nervous system's going to switch, and then our physiology is going to change. So the dance between sleep is no different. When you're awake, you're in a sympathetic state, which means there's a nervous system that's your awake state, is what we call it, which is sympathetic system. And then when you're sleeping, where your body heals, so that's your survive system. And then when you're sleeping, your thrive system kicks in, and that's where your body grows, repairs. That's where your immune system lives, your digestive system lives, your reproductive system lives. So it's a balance between these two nervous systems. So anything that stimulates us to be awake is going to suppress our ability to sleep. So think about this. Think about if you have the TV on and you have lights that are flickering, blue lights that are telling you that it's daylight, or there's action on the TV, and then it puts you into a sympathetic dominant state, or it keeps you in an awake state. So anything that stimulates your system to be out of this balance and be out of this be out of the awake state and go into the sleep state is going to affect the critical time of body healing, which is done in the first third of your sleep cycle. So yes, falling asleep with the TV on is very, very, very bad habit.
So I'm going to play devil's advocate, because so many of my patients say that watching TV is how they fall asleep. And if they don't do that, they can't relax. So it sounds like the opposite of what you're saying. You're saying it's keeping them awake with the lights and that kind of stuff. But then the report is it helps me fall asleep. How do I help my
This is
patients with
great.
this?
So people have typically problems falling asleep, staying asleep, and then waking up well rested. If you cannot teach yourself, and we have techniques in so many different ways to do this, to shut off your conscious brain, and you just are watching TV to get into a rhythmic state, that is a bad habit, because you're not teaching a good habit, right? It's almost like, oh, my child can't sleep as long as I put him in the car. So every night I drive them around town in order to put them to sleep. And then I bring them into the house really quietly and put them on their bed. Well, that's not a good habit. We need to be able to develop the tools to be able to so we have to identify what the perfect night's sleep is, and then develop the tools to get us there and get rid of the bad habits that we're living with right now to be able to get to sleep right now, because there are so many more effective ways to be able to teach somebody how to shut their brain off than just keeping the TV on.
That would be great. But it's hard, right? On one hand, we have people who, when I went to medical school, we kind of like, oh, I didn't sleep at all last night, or I've slept 3 hours in the last 2 days, kind of like I can sleep when I'm dead kind of thing. To now I have some patients who are like hyper vigilant, like they feel fine, but then they look at their aura ring and then they interpret that they've had a terrible night's sleep because of this data. And I'm not saying that these these devices are bad. I love data, but I don't think hyperfixating on it is the best thing to do. So speaking of these devices, there's lots and lots of information, and I don't think that very many people, including myself, really know what to do with all of that information. So you're talking about quality sleep. So if we were looking at all the parts of our sleep, what are the parts that we're missing? Is it REM sleep? Is it deep sleep? Is it the rhythm and we're not getting up and down enough? What makes a good quality night's sleep?
You are so great. I love you for asking that question. Okay, let's give you the anatomy of the good night, a great night's sleep, right? And then we're going to back in a structure to be able to give that to you. So first off, being able to wake up, recharge, re-energize, and ready for the day. So it's our mission at Dr. Sleep Right to awaken the full potential of a well-rested, aligned you, right? So who are you trying to become because of getting better sleep? Do you want more energy? Do you want better weight loss? Do you want better cardiovascular health, digestive health? All of these things, it estimated 80% of all chronic disease is related to some sort of chronic fatigue. So now, when we look at the perfect night's sleep, what needs to happen in the first third of our sleep cycle, let's say it's 9 hours. The first third would be the first 3 hours. Second third, obviously, the 1 to 3, 3 to 6, 6 to 9. The first third of our sleep cycle, very specific thing happens. That's your deepest sleep. That's when your heart rate should drop quickly. Your respiratory rate should drop quickly. And your body core temperature should drop quickly. And then you get into deep sleep. That's when your body heals. Your body heals, recharges, grows, re-energizes during deep sleep. That's the first third of your sleep cycle. A lot of people have problems with this because of our habits, and I will discuss that in a few minutes. Then you have this transient second state where your body is both going into deep sleep and then this REM sleep that we talk about. And REM sleep is where your brain heals and recharges. So you have body healing in the first third, REM sleep in the last third of your sleep cycle. And then there's that transient time in the middle. So if you have a lot of anxiety, like me, you have the ADD and your brain goes a million miles a minute and you can't shut it off, you're going to require a significant amount of REM sleep because your body needs to defrag because you're an internalized thinker. If not, you're going to be fatigued, run down. And consequently, if you're exercising a lot, you're doing some damage or your body's healing from something, you're going to require a lot of deep sleep because the body needs a lot of repair. So it's really important for our body to go through this deep sleep phase naturally in about 4 to 5 sleep cycles a night, where you come into deep sleep and out of REM sleep, REM sleep, deep sleep. And then, it's a nice smooth curve all the way through the entire night. So when we think about that, let's say that is the perfect night's sleep. Deep sleep at the beginning, REM sleep at the end. The sleep trackers don't get caught up in the data because you'll go out of your mind. But I do agree that you cannot improve what you don't monitor, or you cannot improve what you don't quantify. So we're going to go into what I think is the biggest factor that you should be paying attention to as far as overall health. Don't worry about the sleep yet, not at the beginning. It's overall health. And then we start to implement changes. Don't focus on the sleep data at the beginning. Focus on this one thing, this one metric that I'm going to give you. And then that is how you're going to determine how much sleep you need based on what your current habits are like. So people always ask me, how much sleep do I need? And I often say, do you track your heart rate variability? Heart rate variability is the measure of that autonomic, that parasympathetic and sympathetic nervous system's impact on the heart. How if you cut all the nerves to the heart would beat at 100 to 150 beats per minute. The only thing that the nervous system is in control of is regulating it. So it either speeds it up or slows it down, speeds it up or slows it down. So that dance between the variability of the heart rate depending on which nervous system is in control, you have a score. It's called HRV.
Now,
It
let's
tells
stop for a moment and explain a little bit for our audience what HRV is, because it's counterintuitive, right?
it is. So you think, well, not you think, most people believe that if you have a heart rate that beats at 60 beats per minute, every second there's a beat. Boom, 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 boom. Well, that rhythmic pattern puts a significant strain on the heart because it's like a pump. The pump will blow up because it stresses one portion of the heart all the time. A variable heart rate is a heart rate that goes bum 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 bum. So it beats in a very rhythmic pattern, which disperses the stress around the whole heart, making the body ready for adaptation, making it ready for anything. So a sympathetic heartbeat, when you exercise, boom, 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 boom. It's a very rhythmic heartbeat because the body needs to depend on the specific amount of flow of blood and nutrients to the cell. So it rhythmics makes it very rhythmic, very regimen, like 60 beats per minute. Then as we calm down and we relax, the heart rate gets very arrhythmic because boom, 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 boom. Now it starts to transmit the force throughout the whole heart, but that's a more adaptable system because it's ready for that sympathetic engagement. Does that help?
Yes, absolutely. So variable is more resilient, steady is more stressed.
Great. Yes.
Question for you. So the GLP-1 medications have been shown anecdotally in lots of physicians, including myself, to have our patients notice and document an increase in the heart rate. And this is noticed at night, especially, probably just because you're laying there. And it's more than a little bit, but it's not a huge amount. And it's sort of said like, okay, well, what's going on? We don't really understand. Do you know if anybody has looked at these increased heart rates in the GLP-1 medication taking population and see the effect on heart rate variability?
So let me tell you what I mean. To me, the answer is very apparent, and I would love to let's talk through it, and then because we all remember we live our life through our nervous system. The heart is controlled by our nervous system. So GLP-1 does what to the digestive tract? Does it increase motility or decrease motility?
Way slow down. Yeah.
Right? So motility, is that increased by the parasympathetic nervous system, do you believe, or decreased by the parasympathetic nervous system?
Well, I know the parasympathetic nervous system allows us to digest and rest and absorb.
So the parasympathetic nervous system increases motility, which creates heart rate variability, which slows down the heart rate. So if you are going to decrease motility, you need to sympathetically stimulate that. So there's going to be some sort of sympathetic stimulation. Does sympathetic stimulation increase heart rate or decrease heart rate?
Increase, yeah.
And then what's that going to do to HRV?
Make it worse.
Make it worse. So that would be my explanation as to why that
Or
happens.
Expectation of what we would find,
yes.
if we were measuring that, yeah. And so back to cardiovascular disease and sleep. So we've got this first third that's resting the body and repairing the body. I would imagine that growth hormone is released in that period of time. You know, our kids literally do grow overnight. So the growth hormone spurts happen at night. People who are taking peptides to stimulate growth hormone, the secretagogues, it's best and often prescribed to take in the evening to facilitate that. But what's happening if we're getting a terrible night's sleep? So I would imagine that the heart is part of the body, so you're not getting the repair and the rest and the rejuvenation. But is there damage happening?
Absolutely, and this is so we're gonna come all the way back out first, and then we're gonna dive back into that because I want to introduce a concept, or not even concept. Now we've done it with thousands of patients. Introduce a variable to sleep that is the missing crust, and it's connected to the nervous system. Because most people, when they think about sleep, most experts, it's a two-legged stool of a three-legged system. They look at rest, repair, rejuvenation, but nobody looks at the structural degradation and how that affect, how destroying your posture at night while you're sleeping, the impact that has on the central nervous system, and then the body's ability to regulate itself and heal during the day. So here we go. So we came up a year ago with the concept of this triune of sleep, the sleep triune. And this says there's three things at play in order for the body to get a good night's sleep. Because remember, you are not in control of your sleep when you fall asleep. You are only consciously in control with how you fall asleep. So I want to only live with you in your bed for 10 minutes. Then I'm out. So I'm like the 10-minute sleep expert. I only want to control how you fall asleep because I know I can consciously control your subconscious brain by doing specific things because your subconscious brain is ultimately in control of your sleep. The conscious brain screws everything up. The subconscious brain's in control, and all the body wants to do is be in alignment and not be in pain, because the number one reason we get restless sleep is because we're in pain, because your sleep centers and your pain centers are right next door to each other. And immediately when you fall asleep, after 20 minutes, the average person will toss and turn every 20 to 30 minutes, which is 20 to 40 times a night. It's ridiculous. It's crazy.
And is that because they're feeling uncomfortable and
because their body's in pain? Yes.
They're in pain to some degree. Even with people who don't say they're in pain, like I wouldn't say I have pain, but you would say that I toss and turn.
So what your conscious brain thinks is comfortable is very unsustainable for the body, but it feels safe for the subconscious brain. So let me explain that. I want you to do a test. It's a 2-hour test. Watch a 2-hour movie without moving in the position you fall asleep in. And most people, it's not even possible because they have to move out of that position because you're going to be in discomfort.
Okay, I'm just moving right now, even thinking about it.
You could put me to sleep, right? In my position, right? And I will stay in that position, and you could put a glass of water on my chest and it will still be there when I wake up in the morning. Because what we do with the triune of sleep, most people mistake comfort for safety. And I'm going to explain that in 2 seconds. So they put themselves together. What they feel is comfortable is not, it just feels safe. So I grew up in Malden, Massachusetts on a busy, busy, busy street. And every once in a while, kids would come up onto my porch, because I was at my room was on the front porch, and they would bang on the window, petrify me, and then run away to play a joke. I thought going to sleep, I was going to be kidnapped as a child. So that's like my fear. So the only way for me to fall asleep was to put all of my pillows around me, to put all my stuffed animals over my head and create a cocoon of safety and pressure to fall asleep, because the subconscious need to sleep is safety. And that safety is what's controlling sleep. And ultimately, and we'll talk about that in a second, but in the way that you think and perceive the world that you live in, if it's safe, you're going to be able to fall asleep. If it's anxious, greed, lust, hate, you're never going to be able to fall asleep and stay asleep, because your nervous system is controlled by your emotions and your thoughts. So if you want to fall asleep, we need to be able to put the body in alignment first. That's number one. Step one of perfecting the triune, put the body in alignment. Number two, create safety for the subconscious brain. We have many techniques to do this. You can use pressure, eye masks, weighted blanket, pressure on your chest, create a cocoon. because when you fall asleep, your subconscious brain does not know if you're on your side or on your back. It only knows pressure. And then the third thing to falling asleep within the first 10 minutes and getting to sleep is the conscious brain. It's where everything's screwed up. It's where I can't, there's no way, this is how I sleep. There's no way I can do that. I have sleep apnea. Nope, this is what I'm told. This is where all of the screw up is. So the trick is reverse the triune. Don't let the conscious brain in. Put the body in alignment, create safety for the subconscious brain, then they give you calm relaxation techniques to get out of your own brain. That's the way to do it.
So then that's why people watch TV, to turn the conscious brain off. It's a distraction.
It's a distraction. And then we also have an animal sleep avatar test that you can take, which identifies your subconscious brain or what animal you need to sleep like in order to know how to create safety. Because a gorilla needs to create safety different than an armadillo, and they need to create safety different than an ostrich. And each one of those avatars basically is identifying your subconscious brain, so we can consciously control sleep by consciously controlling the subconscious.
So I know when I don't sleep, the organ that I find affected the most is my brain. I don't feel energetic. I don't feel peaceful. I get agitated more easily. And my concentration is poor. I'm not making quick decisions. I can't handle my workload as easily or with flow. But what's happening below the ears? Is there inflammation? Like, why does poor sleep affect our heart? Is it an inflammatory process? Is it just the lack of repair? Like, what's going on with the cardiovascular system with regard to poor sleep?
When you put your body into a side sleeping position and you sleep like this, you destroy the structure of the cervical spine. When you destroy the structure of the cervical spine, you affect the integrity of the vagus nerve. The vagus nerve regulates heart rate. So what the vagus nerve does is it's the parasympathetic nervous system. It's the thrive nervous system. It's the nervous system that makes the heart variable. So what ends up happening is when we don't get good sleep, our body goes into a survival state, suppressing our parasympathetic nerves. So we get sympathetic stimulation to the heart. So poor sleep affects HRV in a very, very negative way. So how it affects stress, I mean, there's so many different ways, because there's the amount of verticals that occur because of lack of sleep. But in a sense, what it does is it puts the body into a survival state all day during the day, damaging the effectiveness of the heart. Puts way too much stress on the heart because it makes you more sympathetic dominant. And just the structure of how you sleep. So if you sleep and you put a neck nest or a pillow underneath your neck on your back and you restore this curve, the vagus nerve comes right out from here. You're going to end up having good digestion, good cardiovascular health, good hormonal balance. If you sleep on your side and then you break down this curve, you put pressure on the vagus nerve, suppressing parasympathetic stimulation, which ultimately negatively affects the heart.
And so those people who sleep on their stomachs,
It's
even worse.
It's even worse, yeah. But those are my ostriches, right? So in your neurology, there's a question in the test that asks you to, and you can do this for me, Doc. Can you make a circle and then look at me through the lens through that circle? Now bring that back to your eye. Bring the circle all the way back to your eye. Good. And now, good. You can put your hands down. Are you right-handed or left-handed?
Right.
Do you kick with your right foot or your left foot?
Right.
And then if you were to swing a golf club, or do you do anything ambidextrous the other way?
Yeah. Golf, hitting a baseball bat.
So that's a cross-dominant neurology, okay? So the cross-dominant neurology requires a significant amount of energy to keep the brain stimulated. So you're an internal self-thinker. You have a lot of, like, you're hardest on yourself. You think a lot. It's very difficult to shut that type of brain off. That physiology requires protection when it sleeps. All of us do require protection, but the ADD brain requires a lot more security to be able to hold yourself safe at night when you sleep. So these are going to be like my side sleepers. They're the toughest to break from side sleeping and stomach sleeping because that neurology needs pressure against their chest to fall asleep. So the way that you identify with that animal will tell us how you need to create that safety to be able to first put your body into alignment. Remember, I only want you to fall asleep in the position I want you in. Then you're not in control. Your subconscious brain is. So the conscious brain can be self-disciplined and say, this is what I'm going to do until it hands off the reins to the subconscious.
Well, that's fascinating. So it seems like pressure would be a super easy tool for people to use, whether it's a weighted blanket or a pillow, or I actually use hot water bottles. I know your body has to cool down, but it also is nice to have some warmth. We have our room freezing cold, so it helps to have a hot water bottle, but that is actually quite heavy. So we can put that onto our chest or something to help. Is that a good idea?
Where are you putting the hot water bottle?
Well, I'm usually putting it in everybody's bed just so that because our home is so cool at night, I turn the temperature down 2 degrees starting after dinner.
So it's just under the bed. It's not in the it's not on you.
No, so I just put it on under the covers. So when you get in, it's not freezing cold.
All right. Now, I really, really like that. I like that idea because I'm going to tell you why. Yes, and this is where my advice differs here because of my understanding of the entire system, not just sleep. You are absolutely correct. Your body core temperature needs to drop 2 degrees in order for you to get into good deep sleep, 1.5 to 2 degrees. Well, and you're saying, well, you're using heat under your blanket. Well, that may interfere with the body's ability to drop. As long as because your core temperature needs to stay at 97 degrees. There's no way that the delta from 97 degrees, let's say, to a 60-degree house, that's a significant delta. That will cool a body so quickly that if you don't sleep with any covers, you're going to end up catching a cold because you suppress immunity at night when your body's trying to fight to stay warm. So if you put a water bottle in, keeping the core warm, because that's all it wants, the core. It doesn't care about your hands and your feet. Then you stick your hands and your feet out of the covers so the body can temperature regulate out your radiators. Perfect. I love doing that.
So you just touched on a menopausal trick. Every menopausal woman knows to put your foot out when a hot flash is starting, or some women don't have full on hot flashes. I call them warm moments. You're like, I'm really, really warm right now. But sticking your foot out can help.
Yep. Sticking your hands in your feet because like this time of year, I'm in the northern hemisphere. I'm in Boston and everybody's like, oh, I got bad circulation. I have really bad circulation in my hands. I have Raynaud's. My hands are always cold. Listen, you don't have bad circulation. That is the myth that everybody's been told their entire lives because nobody really understands the neurology. They're not looking at why are the hands cold. Well, the hands are only cold because the body's trying to keep the core warm and it doesn't want to bring hot, warm blood out to the hands to cool it down. So what that means is your core is not warm enough. So you're not bundled up. So I tell people, I say, go outside, put a snowsuit on and have 5 layers on and then go outside and tell me your hands aren't warm. Your hands are going to be warm because it's all about the core. Everybody looks at the asymptomatic effect and nobody's looking at the true understanding of physiology and how the neurology is controlling everything. Everybody thinks things are a mistake and you have a problem. You don't.
We're not looking at why.
Exactly. I'm a why guy. It's like that's why my ADD is so beneficial for me. I always question everything.
Well, and that might be why those winter vests, the down vests, actually, I always look at people like, what a dumb solution. Yeah. But actually, now I think that it might be brilliant.
Keep the core warm, maintain the energy resources in the body that is not wasting, keeping the core temperature up, which suppresses immunity. Because remember, core temperature is a sympathetic, so the survival system, running from a tiger, that's sympathetic dominant. Your body wants to survive before it wants to thrive. That's called the allostatic principle, the allostatic ladder, I call it. So the allostatic ladder is the body is going to bring on, things to survive. It's going to respiratory, cardiovascular. Um, Blood's going to shunt from the digestive tract to the musculoskeletal system. That's why your grandmother told you don't eat and go swimming, because your body is going to survive before it's going to digest your food. So you have these survival state systems. Core body temperature is one of them. In lieu of surviving, your body can't thrive and survive at the same time. A cell can't be in stress, defense, and thrive. So in lieu of that, which is the parasympathetic nervous system, which is where we sleep, which is where we grow, in lieu of that is digestion, immune system, and reproduction. Those are the systems. So if your body is trying to fight to maintain its core temperature all day long, it's going to suppress immunity. That's why people are like, oh, it was so cold in my wind. The wind was blowing on me. I got sick. I think the cold air blew a sickness in. No, it didn't. It's the body adaptation to suppressing your immunity for nights on end, which is why you get sick. So it's not the seed, it's the soil. So we need to look more at ourselves from within, and then look at our lives like we live it through our nervous system. That's why I was so excited that you asked me to speak today, because sleep and cardiovascular health are directly connected, because they're connected by a nervous system that is a weak muscle that we have. That our parasympathetic nervous system is like an imbalance, because we all live sympathetic dominant, and we all have digestion issues, immune system issues, hormonal imbalances, because we never are taught to turn this on and be able to live a parasympathetically stimulated life. That's why it starts with positioning in the bed, by restructuring the mold with your pillow and how you use it, then create safety for the subconscious brain, and then create parasympathetic habits that build that system at night so you can heal.
I think that's so brilliant, because everybody thinks that your parasympathetic system turns on when you're not stressed. They think of sympathetic system as fight, flight, or freeze. Like, if I'm not stressed, then my parasympathetic system is turned on by default. That's not true. You actually have to do something to turn on your parasympathetic system. So I would imagine that a lot of these things that we hear, like don't eat before you go to bed, and don't exercise before you go to bed, these are probably pretty simple. They're just, don't do things that'll turn on the sympathetic nervous system or distract your parasympathetic system from its task to get you to sleep. Would that be a fair statement?
Yeah, that's a great statement. So now you are starting to look at things very different, right? We're now talking about, forget about our sleep. We're talking about, okay, we live our life through our nervous system. Now let's look at how we strengthen our nervous system, and what things can we do to bring our body back to balance. Then you get better sleep. So this is our thing in the Way Better Sleep Academy. We talk about, who do you have to become to do what you need to do to have what you want. It's not want, have, not want, have, be. It's be, do, it's be, do, have. Who do you need to become? Nobody buys sleep. They don't come to, they think they want sleep, right? They're like, oh my God, I want to sleep better. No, you don't want to sleep better. Sleep's a waste of time. You're spending like 8 hours in bed. You want who you're becoming because you're getting better sleep. So you want more energy. You want the impact. So you can't just, just sleep better and then have a healthier life. It's what you do during the day. It's how you regulate your nervous system. So within our Way Better Sleep program, it's mindset, healthy habits, then sleep. Sleep's an I don't know. Sleep's the effect of what you're doing during the day. I can't affect. That's the ADD, dyslexia. You put me in that box. So, but sleep is an outcome to having a way healthier life during the day. And that's really what, I never entered the sleep industry because I wanted to be a sleep specialist. I entered the sleep industry because because of my own personal issues. I had to fix people's spines while they slept to improve their dysfunction in their nervous system. So I entered the industry very, very, very different and from a different angle, from this holistic 350-foot view of holism to be able to then be able to use the bed to help people get better
Well,
stuff.
this is so refreshing because a lot of the sleep experts are really looking at this from an electrophysiology, brain only, or chemical, like melatonin versus L-theanine versus, dopamine versus, all these chemical processes. But it's really the master switch is your nervous system. And your nervous system can be trained. It reminds me very much of, weight loss and longevity. You really just, if you're working on your muscles, then that's actually setting you up for longevity. It's not something that you have to do at the end. So sleep seems similar, that you actually can deposit good habits throughout the day and especially before you fall asleep, so that your master switch, which is your nervous system, which is in control, it's the conductor of this sleep, can actually execute a beautiful symphony. And what it does is it does it at the very beginning. And then after that, what do you do about people, just to finish up, what do you do about people who say they're falling asleep easily, they are deeply asleep, and then they wake up. Now, I know that a lot of women wake up between 2 and 4 in the morning because of a lack of progesterone, but there's a lot of people who are having that problem, even though it's not a lack of progesterone. What about the waking up problem? Because you said that your subconscious is now in control. What do we do about that?
So it all starts with how we put you to sleep. You see, you can't, there's so many variables to this. And that's why it's, we entered the industry with a product. Now we are leading the industry with education, because education is truly, there's so many things that go into this. But to answer that question is, you can't think yourself to sleep. You have to remember yourself to sleep. So how you're putting yourself
Oh,
to sleep.
wait, say that again.
Okay.
You can't think yourself to sleep. You need to remember yourself to sleep. Is that because the thinking is the conscious mind?
Because the thinking is in the prefrontal cortex, and your sleep centers are in the back part of your brain, right? In the cerebellum.
And your brain can't be activated in two locations at the same time.
Nope. Yep. So there's only one time a day that it happens in deep meditation, but in the middle of the night when you wake up. So it's a very addictive time to think. So if you can be in control of two things. You can be in control of thinking, or you can be in control of remembering. And both things can't really happen simultaneously. They do when you're like watching TV, or that's what happens. It puts you into a transient state until you're finally just exhausted, but you're not training the brain on how to remember effectively. So, and then you can also consciously connect memories to sense and different things. And so the brain can be triggered into being in one of these two states. That's like for instance, if you are in a rose patch and you picture yourself like winning the lottery, and you're excited. But if you win the lottery in a rose patch, every time your body smells rose, it's going to give you a nice positive, energetic excitement. So we can do that to the brain. So we have habitual neurological patterns that need to be addressed before. Listen, I woke up this morning because I had to go to the bathroom. I'm cleansing, and I had a big juice. I knew I was going to do it, but I can put myself right to sleep because I've trained myself to not think and remember. So there are different things that we have to do in different times of night when you wake up. It varies, and it means something different. So in the scope of this, it's all about habits, building the habits in using a resource that you trust to be able to go down this road.
So many amazing pieces of information. Nervous system in control of our sleep. Of course, your nervous system affects your heart. There's nothing in charge of your heart except for your nervous system. You can train your nervous system. We need to remember our way to sleep, not think our way to sleep. Just brilliant information today. Thank you so, so much for sharing your knowledge. I know it's going to be helpful. Sleep is a big deal in the US, or problems with sleep, I would think. So thank you so much for sharing.
Thanks, and thanks for giving me the platform to be able to spread our message to help awaken the full potential of a well-rested, aligned you. If you want to find out any more information, just go to drsleepright.com and take your animal sleep avatar test.
So people can find you at drsleepright.com and they can get a deeper dive into maybe some personalized parts. Thank you so much for your time today.
Thank you so much. I really appreciate it, Doc.